Graves' disease and Hashimoto thyroiditis are both autoimmune disorders affecting the thyroid gland, but both of them have opposite effects on thyroid function. One will increase thyroid hormone production, the other one will decrease it. Now let's find out what actually happens in each one of them. Let's talk about Graves' disease first. In Graves' disease, the autoantibodies produced will actually stimulate TSH receptors, resulting into increase in thyroid hormones, and all the clinical features of hyperthyroidism would be seen in these patients, such as weight loss, heat intolerance, palpitations, tremors, anxiety, irritability, increased sweating, frequent stools, warm moist skin. Now let's talk about Hashimoto thyroiditis. In Hashimoto thyroiditis, the autoantibodies produced will actually destroy thyroid follicular cells. The cells which were responsible for formation of thyroid hormones, if destroyed, will result into lesser thyroid hormones being produced, and all the clinical symptoms of hypothyroidism would be seen in these patients, such as weight gain, cold intolerance, fatigue, constipation, dry skin, hair loss, bradycardia, puffy face, and hoarseness of voice. These menstrual disturbances are common between both of them because thyroid hormones have an influence upon the menstrual cycles in female. So whether they increase or decrease will affect menstrual cycle. Now let's find out about the other characteristic differences between Graves and Hashimoto. As we can see, we have used females as the image. That means be it Graves or Hashimoto, both of them will have female predominance. Now let's comment upon the age category. Graves will affect younger females of age 20 to 40 years, whereas Hashimoto would affect middle-aged females of 30 to 60 years of age. Now let's comment upon the onset. Graves will have acute or subacute onset, whereas the onset of Hashimoto would be slow and insidious. Also, let's talk about goiter present in both of them. Would be diffuse goiter, and let's comment upon the consistency of that goiter. It would be soft in consistency in Graves, but it would be firm in consistency in Hashimoto. And the most important sign is your ocular involvement. Ocular involvement will only be seen in Graves' disease, as you can see in this image also. Exophthalmos, proptosis, lid retraction, periorbital edema are characteristic findings of Graves' disease, whereas you will not find any ocular involvement in Hashimoto thyroiditis. That's why in this image, this girl has already put her eyes shut, saying that do not focus upon my eyes. Now let's find out the lab findings which will be characteristic in diagnosis. In Graves, you will see decrease in TSH as TSH receptors are already being stimulated. Therefore, pituitary decreases the TSH hormone production. Also, you'll see increase in free T3 and T4 in these patients, and the characteristic finding for diagnosis is actually the antibody. You will see TSH receptor antibody, which is written as TRAb. This would be present in patients of Graves' disease, and also you can see thyroid stimulating immunoglobulin, which is TSI, being present in Graves' disease. Now let's find about the lab findings in Hashimoto.